We actually have probably 4 abstracts about myeloma 11 at this meeting. The follow-up for this study now is really very long. And so we have 1 abstract concentrating on just updating everybody on the data. And what this really shows is that patients who have maintenance with lenalidomide continue to do extremely well and have long progression-free survivals. The patients who actually do the best out of the study, if you remember, patients within the study were randomized to either cyclophosphamide, lenalidomide and dexamethasone, or cyclophosphamide, thalidomide and dexamethasone, and could then either have a transplant, or if they were older and less fit, didn't have a transplant, and then got randomized to lenalidomide maintenance or not. And the arm that kind of wins overall are those patients that have the cyclophosphamide, lenalidomide and dexamethasone as induction therapy, followed by the lenalidomide as maintenance. Importantly, however, when we look at the second progression-free survival, it wasn't impaired for those patients who had the lenalidomide maintenance, suggesting that lenalidomide maintenance is a good treatment and it doesn't affect what further treatments you go on to receive. There's also some data we're presenting about some of the finer details about what happens if you relapse just on a biochemical relapse according to the IMWG criteria, compared to if you have a clinical relapse, and what are the differences in between patients who do that, and what might you expect in the longer term as far as patient survival is concerned. And we show very nicely that those patients that have quite an aggressive relapse still respond very well to their future therapies compared to those patients who have a more gentle relapse.